With the pros and cons of the most popular cosmetic procedures with myself and Dr. Anthony Youn. From one plastic surgeon to another, tell us, what are the pros and cons?
There's a lot of changes that you can get, so let's focus on the facelift first, because this is the big operation.
Yes.
So this is a patient of mine. You can see she's got some jowls, beautiful woman, a little bit of extra skin there, and this is after a facelift. So a facelift, the pros is you can lift the jowls, lift the neck, and you can see a pretty dramatic improvement.
So you do a neck lift by doing a facelift?
A facelift includes a neck lift with it.
Oh.
Yeah, it's both. It's a lower face and upper neck lift.
Oh,
Yes.
incredible.
And was she happy with that?
Yes, otherwise she wouldn't let me use her photos.
Yeah.
But the negatives of a facelift is that there's scars involved. The scars are in front of the ears and behind the ears, and there's usually the one underneath the chin.
Yeah, but a good plastic surgeon can hide that.
Not if you got short hair. So if like Mark has a facelift, it's hard to hide those scars. They're going to be there. And I don't see any, so that's
no scars.
No scars on him.
And it's a big surgery. And if you can see if people do it too much, you can look like you're in a wind tunnel.
Yeah.
So definitely don't want to do too many of them.
Yeah, because your ears end up back here.
Yes. Yeah, kind of.
Right. Oh, we have seen that. Yes. Yes.
Yes. Or the ears move a little bit.
The ears move.
It's called a pixie ear deformity, where the ear can pull down.
Yes.
Right.
Yes. Yeah.
The
But there's
telltale.
dangers with any plastic surgery, so you always got to find the right surgeon.
Okay.
So let's go ahead to the eyelid lift. This is also very popular surgery. This is a beautiful patient of mine. She didn't like the excess skin of her upper eyelids. She didn't like the puffiness of the lower eyelids. So in an upper blepharoplasty, you remove that excess skin to open the eyelids up more. You can actually improve a person's vision, and some health insurances will even pay for it if the vision
You
is...
have to be a certain age, though. I know. I asked around.
Yeah, there has to be so much skin that you can't see
And the
traffic
eyes are
lights and
tricky,
stuff like
right?
that.
The eyes are tricky.
Yes, because if you take too much skin, especially off a male, it can make them look quite different. So that's the negative with it. The other thing is if too much skin is taken off, your eyelids can pull down like this.
Right.
That is not a good look.
Okay.
Or you can get so much excess skin you can't close your eyelids. Yes,
So
you look
far,
like that.
So
Yes.
far, I'm not hearing any problems.
But if it's done well, you can see a real nice change.
Yes.
So next are PRP injections. So what are PRP injections? It's just a drawing of it, where essentially you take a person's blood, you spin out the blood, you remove the platelets, which are chock full of growth factors, and then you inject that platelet-rich plasma into a person's scalp. So if somebody's got thinning hair here, you can inject it up into the scalp and actually thicken the hair afterwards. It's completely natural, but the negatives, the con with that is you have to repeat it. It's not a permanent change.
Does that hurt?
It's not too bad. It's just little needles, and you're injecting it, so it's less painful than, let's say, filler injection.
You can do it to other parts of your body, too.
Yeah.
I've heard.
Yes, you can. You can actually do it for orthopedic injuries.
Sure. I've had a lot
People
of
use it
those.
for facials as well.
Yeah.
But that's a negative.
All right, how about
You'd
fillers?
be amazed, actually, at where you can put that.
Oh, there are other areas as well.
I've heard.
That we shall not speak of.
Yes.
Yes.
Permanent fillers,
next are
pros and
fillers.
cons, yes.
So here's a patient of mine. Actually, she's one of my employees.
Okay.
Who didn't like her lips. They were getting a little bit thinner, so we injected some filler to make them bigger. So how do you get thicker lips as your lips are thinning as you get older? Well, you create a very nice social media post a few months ago about how you can outline your lips. You can use a lip plumper, topical lip plumper. That can last a few hours, or you can do injections.
Just don't kiss anybody after you put the lip plumper on, right?
Yes, because that can sting their lips as well.
Yes,
You better watch out. So you can do it with a temporary filler that lasts about 6 months.
So wait, that's her unhappy photo, that lip?
Well, she's in her 20s, and she works in my office, and she was like, "Hey, let me just try it."
Right.
And then this is her afterwards. So you can,
I mean, she's going to be shooketh when she's in her 50s.
I like it. That's subtle. It's a subtle change.
But it is, yeah. So you can do it with a temporary filler, lasts about 6 months, or a permanent filler that can last forever. But permanent fillers come with permanent problems. You can get lumpiness, you can get infections even years later.
What's a permanent filler?
Silicone is a popular one.
So you put it in the lip.
You can put it in the lips, and it basically lasts forever. Implants are also used in lips, too. But the problem with those is that if you first of all, accidentally inject, let's say, silicone into a blood vessel, the lips can turn black, and you can actually kill off parts of the lip, and they fall off. I got pictures I can show Mark after the segment if you'd like.
No, this is why, I'm telling you, this is why I keep drawing my lips on, because I feel like lips can go really wrong really quickly.
Yes.
And so I'm just going to stick. I'm going to stick until you talk me into it. I'm going to stick with my lip pencil tricks.
Yeah.
Because I'm so
That
afraid.
definitely works.
So let's talk tummy tuck, pros and cons.
So tummy tuck is a very powerful operation. This is a patient of mine, beautiful patient. God bless her. She had 10 kids.
10?
Yes, and her tummy was all stretched out. The muscle and the skin was stretched out, and this is her after a tummy tuck.
Looks great.
So it can be a very powerful operation. but you get a lot of scarring. There is
What if you just have, like, because I've had 3 C-sections, and, you know, and I'm not complaining at all, but I have a lot of, like, loose skin, like, you know, like the face of a Shar-Pei puppy, you know, like, it kind of looks like that. So like, what's the cure for that?
It's still the same as this operation because you have to cut that extra skin out. So there are non-invasive skin tightening treatments, but they aren't that effective.
Yeah.
And so really
I call them wallet biopsies.
Yeah. So I mean, so really you have to unfortunately cut that skin out. That gives a hip-to-hip scar. It gives a scar around the belly button. And it's a tough surgery. I mean, she was super happy with the results, but she couldn't stand up straight for a week. So it's a big operation to undergo, but big changes, as you can see.
Yeah, that's amazing.
Okay, rhinoplasty, pros and cons.
So this is a #1 surgery, most popular surgery for men, in the top 5 for women. You can see you can get a nice change. I took a little bump off of her nose, and it looks definitely the way she wanted to afterwards. Now, the positive with rhinoplasty, nice changes, minimal scarring. The negative is that it is the #1 most revised operation, meaning that people are unhappy with it the first time, so they have it done again, and then some people have it done again and again.
What do you do with that bump? Do you shave that off?
You basically, you shave it off kind of with a bone file, where you file it down, and then you have to break the bones in to cause the nose to basically become more of like from a trapezoid to a pyramid. So you got to break the bones in afterwards.
You can also do that with shading. Like you can...
Shading is very powerful. Yes, so many people do that. And then the other thing with noses is they can change your voice. So if you're an aspiring singer, make sure you know that they can cause your voice to sound a little bit different. Now, it's not going to cause you from going like this to going like this, but it can definitely cause you to sound maybe a little more nasally and can alter it a bit.
Okay, let's get to the reason we're all here. Breast implants, let's go!
All right, so breast implants, #1 most popular cosmetic surgery for women. You can pick what size you want, but there's a lot of issues with breast implants.
Okay.
First thing is that they're textured and smooth implants.
Which ones do I want?
You want a smooth implant because textured implants come with the risk of a rare type of cancer called ALCL. And so they're still being used. I can't believe doctors are still putting these in patients, but they do have a rare risk of this cancer. Also, you have to keep in mind that implants are not permanent devices. If you have it put in, you're going to have future surgery at least every 15 to 20 years.
Oh, God.
And
I prefer smooth.
I started too old. I should be doing this 20 years ago.
Not necessarily. It just means then you'd have had to have more operations throughout your lifetime. And then there's a risk of breast implant illness. There are some patients who appear to get sick from their implants. We don't really understand that whole phenomenon, but it does
like immune response.
Should I stay flat-chested?
Exactly, autoimmune. I think you've got to keep in mind that it is a health issue. Implants are not permanent devices. You've got to really think about it. This is not an operation that you just willy-nilly go and have done, because there are a lot of ramifications. You can even get hardening of scar tissue on the implant, making them feel as hard as bowling balls.
Capsular contracture.
Exactly. You are a plastic surgeon.
I told you I am. I've investigated. There's not a doctor in this city that does implants that I haven't seen.
Oh, wow.
This seems like something could go really wrong.
If you have plastic surgery, the worst thing that can happen is you can die. It doesn't happen often, but anytime you go under the knife, that is a risk. And so you got to keep that in mind.
Thank you, Dr. Youn.